The most insane medical treatments doctors actually used. Let's start with the questionable and slowly work our way towards the stuff of medical nightmares. Number 10. Heroin cough syrup. In 1898, the pharmaceutical company Bayer introduced a brand new miracle drug to the world. They called it heroin. And yes, that Bayer, the same company that makes your aspirin today, was once selling heroin over the counter as a cough suppressant. Doctors prescribed it to children. Mothers gave it to their babies to help them sleep. The advertisements proudly claimed it was completely safe and non-addictive. Bayer even marketed it as a cure for morphine addiction, which is almost comedic if you think about it. For over a decade, heroin sat on pharmacy shelves, right next to vitamins and cold medicine. It took until 1910 for doctors to realize that their patients were developing serious dependencies. And by that point, an entire generation had already grown up on the stuff. But cough syrup was just the beginning, because doctors had another favorite drug they couldn't stop prescribing. Number 9. Cocaine for everything. Before heroin came along, there was cocaine, and doctors absolutely loved it. In the late 1800s, cocaine was prescribed for toothaches, depression, headaches, fatigue, and even as an anesthetic for eye surgery. Sigmund Freud himself wrote papers praising its effects and recommended it to his patients. Coca-Cola famously contained cocaine in its original formula, marketed as a refreshing beverage that could cure your exhaustion. Dentists rubbed it directly onto children's gums during teething. And here's the wild part. It actually worked for some of these things. Cocaine is an effective local anesthetic. The problem was that nobody understood addiction yet. Patients would come in for a simple toothache and leave with a habit that would follow them for the rest of their lives. And while cocaine was ruining lives from the inside, another treatment was destroying people in a way they couldn't even see. Number 8. Radium Products. In the early 1900s, radium was considered a miracle element. It glowed in the dark and seemed to pulse with energy. Naturally, people assumed it must be healthy. Companies began adding radium to everything. Radium toothpaste to make your smile brighter. Radium suppositories to boost male vitality. Radium water that you could drink daily for energy. One popular product called Radithor was literally just distilled water mixed with radium, and wealthy Americans drank it by the case. A famous industrialist named Eben Byers consumed over 1,400 bottles of the stuff. When he died in 1932, his jaw had completely disintegrated, and holes had formed throughout his skull. The radiation had been eating him alive from the inside for years. His body was so radioactive that he had to be buried in a lead-lined coffin. Yet even after his death, radium products stayed on shelves for several more years. But at least radium was new and mysterious. Some treatments had been killing people for thousands of years, and doctors still refused to stop. Number 7. Bloodletting. For over 2,000 years, bloodletting was one of the most common medical procedures on Earth. The logic was simple. Doctors believed the body contained 4 humors that needed to stay in balance. If you were sick, your blood must be corrupted. So they would cut you open and drain it out. Sometimes they used leeches. Sometimes they used lancets. And sometimes they drained so much blood that the patient would pass out on the table. George Washington, on his final day alive, had nearly 40% of his blood drained by his doctors trying to cure a throat infection. He died that same night. Yet bloodletting remained standard practice well into the 1800s. Hospitals even had special chairs designed for the procedure, with armrests positioned to make the draining easier. Barbers doubled as bloodletters, which is actually why the barber pole is red and white to this day. The red represents the blood, the white represents the bandages, and if cutting you open wasn't enough, doctors had another substance they were eager to pump into your body. Number 6. Mercury Treatments. Mercury was once considered the ultimate cure for syphilis. Doctors would rub it on your skin, inject it into your muscles, or make you inhale its vapors in a special steam box. The treatment would last for months, sometimes years. Patients would lose their teeth. Their hair would fall out. Their gums would rot and bleed. Tremors would set in so severe that the phrase "mad as a hatter" actually comes from hat makers who were poisoned by the mercury they used to cure felt. And here's the cruel part. The mercury didn't cure syphilis at all. It just made the symptoms temporarily disappear while slowly destroying the patient's nervous system. Thousands of people chose the treatment anyway because the alternative was dying from the disease, so they traded one death sentence for another. But mercury at least had a twisted logic behind it. Some treatments were so bizarre that even explaining them feels like a fever dream. Number 5. Tobacco smoke enemas. In the 1700s, if someone pulled a drowning victim from the river, the standard medical response was to blow tobacco smoke into their rectum. This was considered cutting-edge medicine. Doctors believed the smoke would warm the body from the inside and stimulate respiration. Special kits were placed along the banks of the Thames in London, right next to life preservers, so that anyone could grab one and perform the procedure on a drowning victim. The kits contained a tube, a bellows, and a supply of tobacco. Physicians swore by the method for decades. Some accounts claim it actually revived a few patients, though historians suspect those people simply weren't as dead as everyone thought. The practice eventually faded out when doctors discovered that tobacco smoke was, shockingly, toxic. But for nearly a century, this was standard protocol. And while blowing smoke might sound absurd, the next treatment involves something far more disturbing being placed inside the body. Number 4. Goat testicle transplants. In the 1920s, a man named John Brinkley became one of the richest doctors in America by surgically implanting goat testicles into men. He claimed the procedure would restore youth, cure impotence, and boost energy. Thousands of men paid for the surgery. Brinkley performed it so often that he had to keep a herd of goats on his property just to meet demand. The patients would choose their goat from the pen, and Brinkley would perform the transplant the same day. Many patients swore it worked, at least for a while. The placebo effect is powerful, but the reality was that the goat tissue would simply rot inside the body, leading to infections, gangrene, and in at least 42 confirmed cases, death. Brinkley was eventually stripped of his medical license, but by then, he had already made millions. Yet even Brinkley's surgeries seem almost quaint compared to what doctors were doing inside mental institutions. Number 3. Rotational Therapy. In the 1800s, doctors believed that mental illness could be cured by spinning patients at high speeds. They built special rotating chairs that could whirl a patient around dozens of times per minute. The idea was that the rapid motion would rearrange the blood in the brain and restore sanity. In reality, patients would vomit, lose consciousness, and sometimes suffer permanent inner ear damage. Some asylums built massive human-sized centrifuges that could spin multiple patients at once. Doctors documented patients begging to be removed from the device mid-treatment. Yet the practice continued for decades because asylum patients had no legal rights and no one was listening to their screams. But spinning was just one method. Doctors had an even more direct approach to fixing the brain. Number 2. Trepanation. Trepanation is the practice of drilling a hole directly into the human skull, and it is one of the oldest surgical procedures ever discovered. Archaeologists have found trepanned skulls dating back over 7,000 years. Ancient doctors believed that drilling into the head would release evil spirits, cure headaches, or relieve pressure on the brain. The procedure was performed without anesthesia using stone tools, bone saws, and hand drills. And here's the unsettling part. Many patients survived. We know this because their skulls show signs of healing around the drill site. That means they lived long enough for the bone to partially regrow. Trepanation persisted well into the Renaissance and was still being performed in some parts of Europe as late as the 1800s. Some people today still voluntarily undergo the procedure, believing it expands consciousness. There are online communities dedicated to it. And yet nothing on this list comes close to the horror of what happened in the 20th century. Number 1. The lobotomy. In 1935, a Portuguese neurologist named Antonio Egas Moniz developed a procedure that would go on to destroy tens of thousands of lives. He called it the lobotomy. The operation involved severing connections in the brain's prefrontal cortex, usually by inserting a sharp instrument through the eye socket and sweeping it back and forth. Moniz believed it could cure everything from depression to schizophrenia. For this work, he was awarded the Nobel Prize in Medicine in 1949. The procedure spread across the world. In America, a doctor named Walter Freeman performed lobotomies in his office using an ice pick and a mallet. He called it the ice pick lobotomy, and sometimes did 20 in a single day. Patients were left with permanent cognitive damage, personality changes, and, in many cases, a complete loss of emotional function. They became docile, yes, but they were no longer themselves. Rosemary Kennedy, sister of President John F. Kennedy, was lobotomized at age 23. She spent the remaining 63 years of her life in an institution, unable to speak clearly or walk properly. Over 40,000 lobotomies were performed in the United States alone before the procedure finally fell out of favor in the 1960s. The scariest part isn't that these treatments existed, it's that every single one of them was considered legitimate medicine by the best doctors of their time, which makes you wonder what treatments we're using today that future generations will look back on with horror.